Now the next speaker is ready, Dr. Kimaya Chavan.
Yeah. Good afternoon, everyone. At the outset, I'd like to thank Dr. Sahu sir, Dr. Boramani sir, and the organizers for giving this platform. Let's start. Today's topic is M6 training on surgical simulator. So everyone knows in traditional training we have some institute we have very less hands-on experience. Of course, the student has performance pressure, and if you go for code side, there is an availability issue, and also the feel is not very good. So how this simulator help us now? So in Help Me See simulator, it is the only simulator which has a haptic feedback, and it has software which is intuitive. So this is how the simulator looks like. It has the eyepieces, same like our microscope, which you can adjust the IPD with, refractive error, and the desktop is attached to that. So that I will just explain in the next slides how it is used for. These are the haptics which we use as tools to operate in as a surgery in the Help Me See simulator. The desktop looks like this. From here, you can choose the instrument which are actually we want for the particular step to be performed. And of course, we can see the performance data from this desktop, how we are performing in the surgery. This is how we teach in Help Me See Pavai Center, where we are teaching the surgery in 4 different modules. Everything is covered. So I'll just go on for the surgical videos, how you actually look at this. So on the right hand side, you can see the surgeon performing. You can even start teaching the students the way you should, hold the instruments. Here I am using a crescent blade. I have chosen the blade from the desktop. I just choose the crescent on the right in the right hand side, and left I have chosen colibri as my instrument. And now I am performing the tunnel, and you can see the surgical tool on the left hand side, the intraocular pressure. So if the trainee is giving too much of pressure while holding the eye, even that is, the simulator catches that, and it shows you that please hold it softly. So even that much is simulated here. So now, yes. Now I have chosen for paracentesis. I have chosen 15 degrees blade, and I'm through it. You can actually feel the same resistance to the cornea. Now I'm going forward with a viscoelastic injection. You can feel the tension within the antechamber when you're actually feeling the visco. It is unbelievable, but it's very true. You can feel on the cornea. Now here you can see the surgeon, he is going like this and then tilting his hand, then only he can enter as we teach in normal surgery. Everything you can teach the students, every step like this. So just we'll run across the CCC. Now here I'm using a cystitome as my instrument in right hand. I'm going inside and just nicking down there, reverse C shape, and just same way how you do in dive surgery, you can do it. So suppose you have a complication now. So how it looks? Now it is tear run out. So the simulator will tell you that stop it, the instruments will turn red, and you get all whatever problems are there, you can directly see on the desktop. And this is the performance data which you can see after every step where you have gone wrong, where you have to improvise yourself. So it's very good for teaching purpose. The same way we are doing a hydroprolapse here, the steps are exactly similar, at least 90% I can say. This is one of my favorite step. I'll just show you because of time. Delivery step, because here unless you give a counter pressure by limbs towards 6 o'clock, you will not be able to deliver the nucleus out of the tunnel. It is so well simulated, and yes, the nucleus is out. Same way we are doing cortex removal. Here we are actually chosen the Simco as the instrument, and we can actually see the tool there, upper tool at 6 o'clock, where you can see the position of your Simco. Where is it? Is it near the posterior capsule? Is it near the cornea? So you can even teach the students not to be very near the cornea, because otherwise endothelial will be touching, and then even PC can rupture. So if you have a complication like capsule aspiration, that is immediately popped up there, and students, we can immediately say that stop it and start a new attempt again. Same way, IOL implantation. In the bag, intraocular lens implantation. and dialing of the lens. So now, there are many advantages of simulation training. As I told you before, we can start from handling of the instruments, and definitely students can practice repeatedly, which definitely we cannot do in live surgery. And here, teacher and students both are without any stress, because when you are teaching on live surgery, even we are stressed, right? So you can start the pause the patient in the mid of the procedure, which we cannot do in the live surgery. Then, of course, complication rate is reduced. There have been studies which are shown that those who have trained on simulator and then gone to live surgery, minimum 50% rate of complications has been reduced in the patient. So it's actually very helpful. And of course, you can review your own video when you are operating after the surgery is over. So you can detect your own mistakes there. So like this, we are training in the Help Me See Purvai Center. We have ebook, we give the students to study. Then classroom sessions are there. Then lab activities on tomatoes, peel off. Then simulator on simulator hands-on for minimum 3 to 4 hours a day. And then we can take debrief session to explain to students where they have gone wrong. So it really helps. We have complication management courses. We have these things which are with us now. These are other surgical procedures which are in line, and they are actually started. Now, FECO is already started. These are our partners in India, partners worldwide. Thank you so much for the patient listening. Thank you so much.
Thank you, Dr. Kimaya.